Here, up and down exercising.
Yeah, right?
Good evening, my name is John DeCossin, and for this informative speech, I'll be speaking on sleep apnea. For most people, when you hear medical problems like diabetes, high blood pressure, stroke, and depression, you normally think obesity. But there's another medical condition that you should watch out for as well, and it's called sleep apnea. Per WebMD, the definition of sleep apnea is your breathing being interrupted while you sleep. And why does that make that dangerous? It's like you're self-strangulating yourself for minutes on end, but you don't know it because you're asleep. With today's informative speech, I'll be talking on what sleep apnea is, how to identify if you possibly have it, and how to seek treatment. So per World of Meters, we have over 328 million American citizens that are here in America right now. If you look at the statistics from sleepapnea.org, we have over 22 million people that's been diagnosed with sleep apnea. That's approximately 6.7% of the population that has documented sleep apnea. So how does sleep apnea work? You have two different forms of sleep apnea. One of them is called obstructive sleep apnea that deals with blocking your airway when you try to breathe. And then you also have what's called central sleep apnea, where your brain tells your respiratory system to breathe, but in this case it doesn't. Why does it make it so dangerous? Well, what makes sleep apnea so dangerous is that it doesn't allow your body to drop into the fuller, deeper rhythms of sleep that you need in order to help you heal. There was a study done by the American Society of Clinical Investigation back in 1968 that did a study regarding the healing effects of sleep. There's a major hormone that's associated with sleep called growth hormone. Growth hormone actually helps with regenerating all your tissues, including your brain tissues and everything else within your body, and helps reset you for the next day. So sleep apnea actually compounds its damage by you being starved of any oxygen to your brain and tissues. And then also, since you can't fall into your deeper levels of sleep, you don't get the growth hormone that's needed. And going back to that clinical study again, in 1968, they found that the highest peaks of growth hormone in your bloodstream is when you are in your deepest levels of sleep. Okay. So how much sleep is needed for the typical adult from 18 to 64 years of age? Through Sleep Foundation, they've documented and showed in statistics that the amount of sleep that's needed is at least 7 to 9 hours per 18 to 64 year old. Okay. But how can you achieve that if you have a diagnosis like sleep apnea that's inhibiting you from being able to sleep? So how do you know if you have it or not? Well, some of the clinical studies have shown things associated with sleep apnea are being considered obese per the BMI standards, having a greater neck circumference than 17 inches, any history of sleep apnea within your family, or if you have any pre-existing tongue, throat, or sinus problems. Well, where do you go from there if you think you have it? Well, you talk to your primary care physician and you ask for a referral for a sleep study. It's also known as a polysomnography. What they do is they put leads onto your head and put you with a breathing strap and follow you throughout your whole entirety of sleep and see if you have it or not. If you do have sleep apnea, what then ends up happening is that you get a machine called a CPAP, a continuous positive airway pressure machine that helps you breathe. I would like for you guys to take me, for instance, as when I did have a sleep study done, I did get diagnosed with sleep apnea, and per record it showed that I had 38 episodes lasting 30 to 45 seconds at a time that I was not breathing. Calculating all that, that's 20 minutes of starvation of oxygen to my brain. Now that I'm on therapy for sleep apnea, I'm able to be more productive with my life. I've actually dropped some weight, blood pressure's down, and less headaches throughout the day. So to summarize, we talked about what sleep apnea is, how it affects the body, how you should go about treating it. Also reviewing the stats. I mean, 6.7% is a pretty big population of people with sleep apnea. With everybody knowing this information, it would be good to take action and inform people so that not only can they have a better night's sleep, but also have a better quality of life.